Tony DeWitt here, Missouri appellate attorney, retired. None of what follows is legal advice. I'm here to do some video for you today to talk about an interesting subject on the law, and here it is. So today is day 2 of our cruise, and today is the first sea day on our cruise. Sea days are always fun. And the reason they're fun is because you get a chance to walk all around the ship. You get to figure out where everything is. You find out where you can do your laundry. Because although most of them don't tell you this, most of them do have washers and dryers that you can usually pay an exceptionally inflated price to use. But you get a chance to clean your clothes so you don't have to bring, 3 or 4 steamer trunks with you. But at any rate, that's what we're doing today. So I thought today I would talk about critical thinking. Now, when people talk about critical thinking, they often do not define the term by what they mean by critical thinking. Often it's just a metaphor for, I think you're wrong. Do some critical thinking. I think you're wrong. That'd be much clearer to say it that way. Even if they can articulate a definition of critical thinking, they may not understand it, or it may be a definition that poorly encompasses the subject. Like the word success, critical thinking has different meanings in different professions, different social groups, to many different people. But what I want to focus on today is what critical thinking would look like in a court of law. That's because in the jury box is where critical thinking is the most important. Let me give you an example. When I did my first criminal jury selection, I asked potential jurors who believed that if the police had arrested you, you obviously were guilty of something. Now, several of the potential jurors were college graduates, and they didn't raise their hands. The folks who were 18 to 25 also didn't raise their hands, but there were about 15 men and women in this group of 60 people, most of them from blue-collar backgrounds, who raised their hands. And they were being honest, and I thank them for their honesty. Now, if we're thinking critically about that particular issue, why did the college-educated people not raise their hands? Did they really doubt that people that the cops arrested were guilty, or did they not want to expose their bias? You see, there's a tremendous urge among non-critical thinkers to accept the first reasonable answer to a question without thinking if there could be other factors at play. One of the reasons that plaintiffs' lawyers like to think that they have an advantage is because of principles of primacy and recency. So the person who gets to go first, they get to tell their story, and the other side has to tell their story afterwards. And it's oftentimes hard to buy into the second story after you've heard the first. That's why trial lawyers try and craft the most reasonable narrative they can to either get or avoid a conviction. And I'm speaking of prosecutors here and defense attorneys. And of the 9 African Americans on that jury panel, why did they not raise their hands? Were they afraid of being judged, or did they understand intuitively that this was sort of a trick question? Certainly they understood that people the police arrest are at least likely to be guilty, but they also likely had interactions with police that told them that the first black guy running down the street from the liquor store is the one that robbed it, irrespective of the victim telling them that the perp was a white guy who fled in a brown Buick. At the end of the day, the fact that at least one person raised their hand gave me the opportunity to talk about presumptions of innocence, the need for evidence, and other important concepts. And the one guy who was adamant that it was 99% likely that anyone caught by the cops was guilty of something, yes, the judge removed him from the jury for cause, because clearly he didn't have an open mind. Critical thinking in medicine can be even harder for medical professionals. There is an aphorism among doctors that if you hear hoofbeats, you think horses, not zebras. And that works pretty well in America, perhaps not so well in Zimbabwe. The gist of that is that in most cases, the most common solution is the right solution. It's sort of a medical application of Occam's razor. When I was a respiratory therapist, I learned about a condition called epiglottitis. It is pretty rare. It's caused by the organism Haemophilus influenza, which sounds like a virus, but actually is a bacteria. It causes high fever, swelling of the epiglottis, and irritation, obviously inflammation of the epiglottis, and a peculiar crowing sound on expiration. It almost sounds like "Hurr, hurr," that sort of thing. I've seen precisely one case of it in my life. But in that case, the child presented at the ER and he wouldn't swallow. He was drooling because his epiglottis wouldn't close and he was crowing with every breath. His mom was worried about how sick he was, about the fever, and I was assigned to give him an IPPB treatment. Now, any of you out there who are medical, you know that that is the last thing you want to do for someone who has epiglottitis. You don't want to cause any trauma whatsoever to that epiglottis. And this was in a hospital in rural Nebraska, and the pediatrician hadn't seen the kid yet. He had just told the mom to take the kid to the ER, and he'd see the mom in the ER so the kid could get evaluated there. Well, the ER doc ordered this IPPB because he was seeing the child having trouble breathing. But like I said, epiglottitis has a tripwire built into it. If you traumatize the airway, even with a tongue depressor, you can cause a respiratory arrest, meaning that somebody's going to get trached on an emergency basis. And putting a trach into a trachea for a small child who was 5 years old, that would not have been something that even the ER doctor, I think, probably could have done a decent job of. So I told the ER doctor I couldn't do the treatment because I believed the child had epiglottitis. I was told by the doctor that I was a therapist and that I had better do what I was told. Well, one of the things that I learned early on in healthcare was that there were two groups of people with regard to doctors, and one group always did what they were told and sometimes they got bad results. And one group often questioned what they were told and they got better results. So I stood firm, and then I called my boss and I said, he wants me to do an IPPB. I'm not going to do it because the kid's got epiglottitis. Thinking that my idiot boss, who was a respiratory therapist and who should have known his airway problems intimately, would understand what I was doing. And instead, he said, I'll be down there in just a minute. So I thought, all right, this is great. So when he got down there, I explained what was happening, and he told me to watch and learn. He put a mask on the child, and it scared this 5-year-old boy so badly, he lost bladder control. After the treatment, he went back to the ER, and on the way, he passed an anesthesiologist who grabbed the kid, took him to the ER, gave him anesthesia, and then intubated him, which is the standard of care. And the child survived. I was right, and the ER doctor and my boss were wrong. And the idiot boss nearly killed the kid because he was dumber than a bag of hammers. He wasn't thinking critically. I was a new therapist, so obviously I didn't know anything. And it had probably been 10 years since he'd done any study in the field, because at the time there was no requirement for continuing medical education for respiratory therapists. And he could have killed that child. So, particularly in medicine, people evaluate things through the lens of their experience, and they do this in courtrooms too. But I have another story to tell. One of my favorite doctors when I worked in Florida was a doctor by the name of Rudy Shearer. He was a chest surgeon, and he was a magnificent surgeon, and more importantly, just a magnificent person. You know, he's one of those people that I would have low-crawled over broken glass to go to work for. So he called me and he said, I got a patient up in this room and they need to have a bronchoscopy. Can you get set up and I'll be there in about 15, 20 minutes? I said, sure. So I went up there, and when I walked through the door, I could hear a gurgling sound like water bubbling or air bubbling through water. And I looked at this guy, and He was blue in color. And so I immediately went to evaluate the airway with a laryngoscope, and I saw that the nurse who was there in the room, the private duty nurse, had dropped a feeding tube into his lungs and pumped about 200 cc's of Ensure, which is a food supplement, into them. Once I saw the problem, I turned off the pump on the feeding tube, and I immediately intubated the patient, and the woman started screaming at me that I didn't have an order to intubate the patient. And I said, I know the doctor, don't worry about it. And she said, I'm going to report you. And I'm like, oh, do whatever you need to do. We're going to save this patient's life. We'll fight about it later. So I intubated the patient and I started suctioning the patient. And then the doctor came in and he's like, holy cow, what's going on here? And so I explained, I said, I left the feeding tube in place so you could see it, but this woman put a feeding tube in here and that's what's happened. He's got Ensure in his lungs. So he removed the feeding tube, and then we took about probably 45 minutes to get as much of that Ensure out of the lungs as we possibly could. So the reason that this nurse was absolutely positive that she didn't put the feeding tube in the wrong place is because she had been doing that for 30 years. She knew how to place a feeding tube, and she knew it wasn't in the wrong place. But the doctor, in no uncertain terms, told her that it was in the wrong place. And when we started the bronchoscopy and all this white stuff started coming out of the man's lungs, well, obviously she realized even then that she had made a terrible mistake that could have killed someone. So she made that mistake because she did it the way she'd always done it, right? Her experience, the lens that she saw this problem through, was not related to the feeding tube because she placed that, but then the guy started having trouble breathing, so it must be a breathing problem. It couldn't have been a feeding tube problem. And unfortunately for her, it was. Now, I didn't report the nurse to anybody. She felt really, really bad, and I'm pretty sure that Dr. Scherer didn't report her either. And she learned a valuable lesson. Now, I say all this not to point out that I was a good clinician, but rather to show that people evaluate things through their own lens and through their own experience. And that's a problem when you're evaluating things like information. Her experience, like that of my idiot boss in Nebraska, colored her ability to work through the problem. Critical thinking means looking at issues and problems first with an open mind, and then applying the tools of analytical thinking, problem solving, and reflective thinking. Critical thinking is an intellectually disciplined process. It's a process that involves actively and skillfully applying the tools of analysis, synthesis, research, and evaluation, coupled with observation, experience, and reflection. In short, critical thinking is a self-guided, self-disciplined thinking that applies reason at the highest level of quality. Individuals who think critically live better, more productive lives, and they make better decisions. Let's look at some of these tools. Analytical thinking involves evaluating data. For the best analysis, that data should come from multiple sources in order to eliminate the bias in conclusions. So, for example, in Charlie Adelson's trial, the data came from detectives, the data came from witnesses, the data came from phone calls, all different sources that led you to the same conclusion. And in medicine, they do the same thing, multiple sources of information. You use a stethoscope and you listen to lung sounds. You get a chest x-ray. Sometimes you get an MRI. You look at the color of the patient's skin, and you draw blood to find out what the oxygen saturation is. Multiple sources of information eliminate bias in conclusions. Analytical thinking permits critical thinkers to identify and reject cognitive bias. Analytical thinkers identify patterns and trends in the data. They break down complex issues into manageable components. They recognize cause and effect relationships, and they evaluate the strength of arguments and evidence. That is essentially what analytical thinking is. In the legal world, we apply analytical thinking when we take a prior case, for example, the District of Columbia versus Heller, and we extrapolate it to argue for the result that we obtained in the Bruen decision. We said, you said these things in Heller, you need to extend it to this Bruen decision. And that's exactly what the Supreme Court did. So let's look next at open-mindedness. Open-mindedness is exactly what it says. It's the ability to consider new ideas, new arguments, new information without rejecting them out of hand. It's the primary way that the way we've always done it becomes the new way we're going to do it. There is a story of a young college student who, for whatever reason, found himself in an elective that he needed for graduation, and so he chose a cooking class. It was one of those life skills sort of things. And in that class, he learned that cooking meats with the bone intact imparted additional flavor. And that struck him as odd because his family always removed the bone from the leg of lamb before they went to cook it. So he asked his mom, "Why do you do that?" She said, "Well, I don't know. I'm following my mom's recipe." So he asked his grandmother, and she said she didn't know, but maybe they could go talk to his great-grandmother in the nursing home and find out. The great-grandmother explained that as a new wife, she didn't have a big enough pot for the leg bone to fit, so she removed it. So for all of this time, they were doing it wrong, based not on what was the best way to do something, but on the way that they'd always done it. People develop a bit of stasis. They do what they've always done, and they do it for that reason. Open-mindedness means understanding that any task has multiple ways it can be accomplished, and the goal should be the one that obtains the very best result. This critical thinking skill helps you analyze and process information to come to a conclusion freed from bias and prejudice. Open-minded critical thinkers are able to consider alternative processes and methods. They are the people who suspend judgment until all the evidence is gathered. One of the things that, for example, we tell people when we give them jury instructions is, you are not to discuss this case or deliberate until all the evidence is in. That's to prevent them from losing that open-mindedness. They respond to constructive criticism and feedback without defensiveness, and they update their processes and methods when they acquire new information. Critical thinking is the foundation of effective problem solving. It involves identifying issues, generating possible solutions, evaluating the alternatives, and implementing the most reasonable and practical course of action. Key aspects of problem solving include clearly defining the problem based on observations rather than experience. In other words, you use data, not anecdotes, because data is not the plural of anecdote. You gather relevant information from multiple sources and methods. You generate multiple potential solutions and identify both the positives and the negatives of each potential solution. And then you implement the solution, and then you evaluate the solution based on the monitoring and the data that you get when you reevaluate. And you do that as necessary. Reflective thinking is simply sitting back and evaluating the process used to achieve a result and then critically evaluating the solution. Were there unintended consequences of the process used? Is a better solution available? Even more important, reflecting on what your preconceived notices may have been and that introduced some bias into the method or process. Systemic bias not only occurs in race relations, it occurs in business in terms of operations. If every problem looks like a nail, your solution is always going to be using a hammer. Sometimes a different approach is a better approach. Key aspects of reflective thinking include critically examining your assumptions and cognitive biases, considering diverse viewpoints and perspectives, synthesizing information from all the various sources and from your experience too, applying insights to improve future decision making and action, and continuously evaluating and adjusting your thinking process to eliminate cognitive bias. Now, there are hundreds of resources on the internet to assist you in learning more about critical thinking. Do your own research and take the implicit bias test found on the internet. You can search for the implicit bias test on Google. Use the results to assess your critical thinking skills and your problem-solving skills. That's what I have for you today. If you have any questions, drop them in the comments down below. Like, share, subscribe, all those things we ask you to do. If you would like, you can email me at the address above, but I'm on a boat. I'm probably not going to see it until I get back. But at any rate, thank you so much for being here. If you have the opportunity today, do something nice for someone. And that'll just make your day. It always makes your day when you do something nice for people because it makes our world a better place. Then when you're done, come on back down here to the beach. Join me tomorrow. We'll talk about something else.
Hey, as I said at the beginning, none of what I said is legal advice. But let me tell you what, the stuff that's going to be right up here, these are the things that YouTube thinks you might be interested in going forward. Have a terrific day.